I would like to welcome everyone to this discussion again. And I would like to say a very important point about the difficult patient scenarios in the exam. My friends, you all are aware that those patients, when comes in the exam, they will come to actually put you under stress, okay? So if your role player is very expert, or your role player is really have a good training, you know, and how to act as a difficult patient, okay, I think it will be very tricky to manage them. However, sometimes you have a situation from the clinical point of view, it's straightforward, but you're trying to convince the patient and the patient is not listening to you and turn to be angry. So the patient comes to you with a request or a demand, patient start to be nice, and then after that, the patient will turn against you. However, you are just telling what the guideline says, right? So you need to understand the situations, and you need to know what is those scenarios, right? It's all about acting, you know. Remember, this is just an exam and everybody play a role, okay? So this patient is not actually angry against you, okay? It's nothing personal, but the exam committee just test how are you going to respond to this patient, okay? Many situations can simply solve it with a good communication, right? It doesn't need to go to the NHS complaint procedure or go to even the court afterwards and sue the hospital for what, okay? So a good communication is very important, okay, in real life and post in the exam. So both of them are very important. And I would say that it comes under the patient's safety, right? And also it comes under the hospital safety, right? Okay, so why training of such situation between you and your study partner can sometimes actually be misleading. Why? Guys, in the training groups, okay, or in the, while you have a study partner, you usually have this nicey discussion, you know. So I say, hello, good morning, and you answer, hi, it's me, and so, okay, so you don't have this experience of tough or difficult situation with a role player, okay? That's because your study partner, you always study with your partner and everything goes nice, right? So let's see. Today, what are you going to do if you have an angry patient? First of all, I would like to say that angry patient is not actually angry, okay? The angry patient can sometimes desperate, okay? Desperate patient. Sometimes patients have a very huge concern about their own health. Sometimes the patient is just afraid, okay? And it's just a defensive mechanism. So, first of all, you need to be curious about why they are angry, why they feeling this way, and don't be defensive. Even if the scenario says that you are the doctor who did this and that, okay? Or the scenario says that this is your colleagues who did this or that, okay? And you think that this was the right thing to do. Please, okay? Don't take it personally again. And don't be defensive. This is very important advice, okay? So what is the advice for the technique? Advice for the technique is very important in the 2 minutes before you start the station. Once you have in the station anything about the patient is angry, the patient is frustrated, okay? The patient is stressed. You need to be wise in approaching this station. Very important advice, okay? Please don't approach this station, okay, like normal, any other station with a big smile. Hello, good morning, how are you? No, you have to understand in the 2 minutes what is the situation. Situation awareness is very important, okay? So the situation seems like your patient is angry, your patient is not satisfied with the care or the system, that the patient is waiting for 2 hours, right? So those scenarios, when it comes to you, you have to know how to, prepare and how to go for the first minute and impress both the examiner and the role player, right? So if you have a patient, first of all, the patient, from the scenario that the patient is stressed, or the patient coming to see someone else, not particularly you, okay? So please start by the tone of voice. Be calm in your appearance, okay? Avoid the big smile. Just be neutral and kind, okay? And greet the patient. Try to address the patient by name. That would be very important. The only time when I tell you don't address the patient by name is that you're not able to read the name. I'm sorry. Okay, sometimes the names are very, long, or you are not, British. Okay, you're not familiar with those names. Sometimes difficult to pronounce. Okay, so unless it's difficult to pronounce or you can't read the name correctly, okay, address the patient by the name. And that's why, by the way, in most of the exams, they use common names. Sometimes they even use a celebrity's name. So you will find something like Will Smith, okay, Mrs. Will Smith, no problem, no problem. Mr. Will Smith is coming to you, no problem, okay. John Stewart, patient name Sarah Jones, patient name Julia Roberts, okay? You find this in the exam. Why? Because they want you to address the patient with name, and they bring easy, famous names. That's it, okay? In my exam, I remember there was something like Claudia Schiffer, Katy Perry, okay? So it was all full of celebrities. So greet the patient, try to use the patient name, okay? And introduce yourself and your role. This is very important, especially if the patient is expecting someone else rather than you. Like the scenario says you are the ST5, okay? And then between the lines, they said that the patient is waiting for a consultant. Okay, so you're not the consultant. Simply apologize that your consultant is busy or away, according to what comes in the scenario, and you are here in behalf of your colleague. And is it okay to continue on the consultation? Please do that. Okay? Don't just ignore what's written in the scenario. It's written for a reason, right? Everything written in the scenario is for a reason. So your colleague in a vacation, okay, so a patient comes post-operative, she is not happy about the operation, or she had some side effect or complication, and the doctor who did this operation is your colleague and he's on a vacation. So just apologize, okay, about that. I'm sorry, I know that you are expecting Dr. Jones, but he's away on a vacation, and I'm here today in behalf of him. Is that okay for you to continue on the consultation? If she said yes, then it's fine. Of course, she will say yes to the exam, right? So this is a very important introduction, okay? So in the first minute, which is the golden minute, you are now able to impress the examiner and the role player, and you are starting the good start or the correct start for the station. When you sit, okay, in other station, like for example, breaking bad news, when we discuss it, or when we discuss something like sensitive issues, we will advise you to lean forward to the patient, okay? So the patient feels the support and feel that you are, somebody who is really caring about her. But if the patient is angry, okay, don't lean forward to the patient, okay? Don't get too much close to the role player, please, okay? Why? Because if someone is acting that is stressed or under pressure and you are sitting near or you're getting closer, that's mean you are putting more pressure on that, okay? So what you need to do is you sit upright, please, okay? That's very important, okay? Sit upright and with the eye contact. This is very important, okay? You never be busy in this station with your notes. You never be busy by reading the situation or anything. Remember, okay, it's doctors got talent. So just sit there, you are upright, maintaining eye contact with the role player, and you are listening. And it's very important, okay, that you show active and attentive listening. We come to the point of listening because half of your mark is to show that you are listening and to show empathy, okay? Then we come to the tone of voice. Your tone of voice should be calm, okay, and stable. Don't use a high tone of voice or low tone. Low tone indicates that you are in this situation. If somebody is accusing you to do some mistake and you're using a low tone, okay, that means that you are the inferior now. Don't do that in angry patient, okay? That will indicate that you feel some guilt or something. No, just yes. So when you speak to the patient, yeah, Mrs. Jones, I can see that you are right. You have the right to be angry. And I'm so sorry about what has happened to you. When she say that I've been waiting for 2 hours and this is too long, yes, absolutely correct. So it just, you are using a calm and stable tone of voice till this person calm down, okay? And then after that, you can lean forward or you can speak quietly, whatever you want. Okay, guys? Okay, so regardless the situation has come about, okay, you are now in the confrontation and you don't want to go into a conflict with the patient and make the patient even more angry in this situation. You are the professional person in this room, right? So if we speak that there is a doctor and there is a patient, right? You are the professional one. So that's mean you are the one who need to follow professional steps. Okay, so what you will do, you will think as late. So late is for listen. And when I say listen, please, that's mean every cell inside your body is listening, okay? So you are listening very carefully, okay? Attentive listening. Don't just think about how I'm going to end up this 10 minutes. Oh my God, this station now is ruined for me. Oh my God, why the role player is doing that? No. You are in the clinic or in the ward or whatever the place in your scenario, okay? You're sitting there with confidence and you're serious. You're listening to the patient complain as it's a real complaint, okay? Every word come out from the patient had very important clue in this task, okay? So listen. Don't interrupt at all. Don't say but, okay? Even if you think that the time is passing, okay, in the station. Like, for example, the role player in one station was instructed to speak for 1.5 minutes or 2 minutes, okay? Don't say, oh my God, the history time flies now. Oh my God, this is 2 minutes out of the 10-minute station. I will try to stop here. Never. Okay? Just do something like nodding by your head. Say, yeah, agree. Yeah, I can see. Oh my God. It must be difficult. That's it, okay? Don't interrupt. Don't say, yes, I can understand, but never, okay? Never do that. Acknowledge. That's very important. Okay, so A is for acknowledge. You need to acknowledge their feeling and what they feel at the moment. This is very important. Okay, because if I told you, for example, sometimes when I do stations with a candidate in the course, one of the I tell her in my story as a role player, in my last delivery, it was very horrible, you know, so many people were there and looking at me. I was exposed, I feel humiliated, and it was difficult. Then I find that the candidate didn't acknowledge that. She just paused in her consultation. You know, I feel bad. However, I'm just playing a role, but I feel bad. Oh my God, she didn't give any attention to my feeling. She didn't empathize with me, okay? She didn't acknowledge that what has happened to me was very difficult and it must be traumatic. You need to acknowledge their feeling and their fears, please. Okay? Put yourself in their shoes. Okay? So somebody is acting like angry husband. Why? Because his wife was having a prolonged rupture of membrane, and then after that, baby was admitted to the neonatal unit. He didn't see the baby so far, and he's so angry. He's the father, and he's angry, right? Just acknowledge their feeling, guys, right? Take an action. T for taking an action. You have to take an action, and it should be the correct action regarding maybe do something to solve the situation, escalation, maybe reporting, maybe, okay, arranging another meeting, maybe, okay. Those are kind of actions that you can take. Explain. You need to debrief the patient at the end and explain the situation, okay. And it's very important to follow those steps, okay. So here, my friends, again, the late, L for lesson, okay? So you need to let the person speaking, even if the patient relative, without any interruption, okay? Let them vent, okay? Let them just read off what, you know, whatever feeling that they have out of their chest, okay? You have to wait until they finish, okay? Just give them some, you know, some nod of the head, some comments, you know, just to ensure or to show that you are actively listening, okay? You need to acknowledge their feeling, and the golden word here is empathy, okay? So this is very important, okay? And whether the issue is the patient fault, your fault, or another colleague fault, okay? Don't be defensive, please. Okay, so the first thing you should do is apologize for how the patient feels. Okay, reflect their anxieties back to them and show that you are listening. Okay, very important point. Okay, that you are apologizing for what the patient has been through or what the patient feel. Okay, I don't apologize because the patient had a third-degree tear. I'm sorry that you had a third-degree tear in your delivery. Okay, but I apologize that she has been through this difficult experience. You got the difference, my friend? There is a difference between the two situations, okay? So I'm sorry because you are in this situation. I'm sorry because you are feeling this, but I'm not sorry about some of the complication. Be careful of what you said, okay? Take an action. You need to address the patient concern, whatever the patient want, okay? Carry out further counseling if required, okay? And very important, okay, that you give the patient appointment for follow-up their complaint or follow up this appointment. Why? They love follow-up. In exams, they love the follow-ups. This means that you need to state that you will discuss this issue in the next staff meeting or with the consultant, okay, or with your colleague, okay? You can also escalate. You can do a significant event analysis or an incident reporting if this is required. And you can invite them back, okay, to discuss about what has happened, okay? So when we take these things seriously, okay, and we investigate what is happening or what has happened, and if things can go differently, okay, you need to update the patient by the result of this investigation, and you need to arrange another meeting to follow up. If the patient comes here herself, she is your patient, okay, you can say that you are also inviting her husband or her the partner, okay, to attend this meeting if she agree. If the partner is the one who's speaking to you, then invite, of course, the patient herself, okay? This will be in the presence of the patient, in the presence of the consultant, okay, and yourself. And if somebody else, like your colleague, have done the operation for her or something, or have seen her before, and she is complaining against your colleague, you need, okay, to also mention that your colleague, you'll arrange another meeting with your colleague, okay? That's very important, okay? A very important point I would like to say here about the colleague, okay? Because it's a trick in the exam. How? Please, if the scenario says that your colleague have done a mistake, she is saying that the patient comes and say that your colleague done a mistake, okay? And you see from the scenario written to you or what the patient says that your colleague is faulty, okay? Please, please, don't incriminate your colleague, okay? This is a problem now, and you will fail because of that. Safety of the hospital, this is one thing. Safety of your colleague, this is a second thing, okay? So you can apologize on behalf of your colleague without incrimination, okay? So you can apologize for what has happened. You don't need to defend and say, yes, but, or you don't ever, okay, incriminate your colleague that it must be his mistake or her mistake. Don't say that, okay? It will be taken against your colleague and against the hospital in the court. Plus, you didn't see the situation. You were not there, so you can't really judge, okay, the situation. Just promise that you are going to contact, okay, your colleague and contact the team, and you will find out what has happened, okay? But don't incriminate anybody. That's it. Another thing, okay, if it is a never event, okay, then what you will say is that this should never happen. It must be wrong. I'm sorry that this has happened to you. And also avoid saying, this is must be wrong, okay? My colleague did a never event. It's absolutely his mistake. Can I say that, my friend? Can I say that it's a never event, my colleague never have done this, and he must be wrong? Can I say that? No, never. Okay? So you always be respectful to the patient and your colleague. Clear, my friends? Okay, how about pulse? You notice, my friend, in the stations that if the patient is still not happy about the care that she received, she wants to, do a formal complaint to the pulse. Shall I volunteer by guiding her to the pulse, or what? What do you think? Shall I volunteer? Wait till the patient mention about the complaint, please, okay? So you are promising her, okay, to explain the situation, to find out what has happened, to discuss with your colleague, to escalate the situation and, you know, significant event, okay, will be analyzed. You are inviting her for a follow-up meeting, okay? You will be open and transparent regarding the result of this meeting. This is what you promise to the patient, okay? If the patient is so happy so far, okay, then everything is okay. If the patient is still not happy, and she mentioned about the complaint, okay, then you please guide the patient, okay, to the pulse and provide them, say that I'm going to provide you with a contact number, okay, or we have here the patient advice and liaison service, okay, and they will be happy to help you. Okay, so I will not volunteer mentioning about the complaint. I will wait, okay, if the patient is still not happy till the end and she want to complain, then in this case, I need to facilitate her and I need to give her the contact and guide her on how to approach the pulse. Clear, my friends? So who will be my first volunteer today?
Hello, ma'am.
Hello, dear.
Yeah, my name is Fatima. I can do station if
Okay.
someone is.
Okay. So we will just take in a minute, okay?
Okay.
Just make sure that you are all guys muted, please, to avoid any interruption to the record afterwards. Dr. Fatima Dia, here is your station. Okay.
Okay, ma'am.
After 2 minutes, okay, you should be ready to start. Okay, so I will start your timer after exactly 2 minutes.
Okay.
I think you might start now, my dear.
Hello, I'm Dr. Fatma. Am I talking to Mrs. Miller husband?
Yes, it's me. It's Robin.
Okay. How can I call you?
Mr. Robin, it's fine.
Okay. So, Mr. Robin, I'm registrar here today on duty, and I'm here to talk to you about the Mrs. Miller condition. So is that okay? So did someone talk to you about this?
Nobody. I'm just waiting here for 2 hours. I'm so worried about my wife, and I don't know what happened to her. She is nearly dying, and nobody
Uh,
have
I,
bothered to come and tell me what's happening. The worrying was killing me here.
mhm. Okay. So, Mr. Miller, I'm really sorry. Please accept my apologies because you are waiting here and it must be difficult for you. So, I'm here to
So why
discuss.
are you speaking so much and you're not telling me how is my wife? Is she's okay or she died now?
Yeah, Mr. Miller, the good news is that Mrs. Miller is doing fine.
Oh,
She is in the ICU. She's in the recovery. So once she will be stable, so we will arrange your meeting with her. Is
so
that
she's
okay?
so she is good.
Yeah, she is in ICU and she is making her recovery. So
What
the
is the
team of
meaning in
experts
she's
are.
in the, what is the meaning in the ICU? What is the ICU?
It is an intensive care unit.
And why she need one?
Yeah, that's why I'm here to talk to you, Mr. Miller. So, as your Mrs. Miller came emergency yesterday, so with some complaints, she was feverish and she was having pain in her lower tummy. So after evaluation, we there was a
Yes,
swab.
there was a small, yes, there was a small doctor. I don't know if he's even a doctor, maybe a medical student, and he just kicked us from the A&E because he was so busy to actually find a real doctor to see my wife. He gave us some antibiotic, and that's why she nearly dying today. She got severely unwell today.
Mhm.
That's because of the
Mr.
mistake of that of the yesterday thing that have seen us.
Mr. Miller, I'm really sorry this happened to you. We are looking into the matter, and the team of the.
I'm okay. I'm okay. Nothing happened to me. It's
Mhm.
it's my poor wife.
Yeah. So this all happened to your wife. We are looking into the matter, and once the report will be ready, we will set
What
another meeting with
report?
you and
What
your wife.
matter? What report and what matter?
The care you, I'm sorry, the care you received, it's not fulfilling your expectations. So that's why we are looking into the matter, like what
You
happened,
expected that
and
this is that you expected that this is even a care? I want to understand what has happened. Why my wife is nearly dying after her operation. They told us that the first operation went smoothly and she went home. She was fine.
Mhm.
And all of a sudden, she got the temperature, and I don't know what has happened, and the pain. And we came here to the hospital. We came here as we've been told to seek the medical advice.
Mhm.
What we
Yeah.
have found is just neglect. And now she is in the intensive thing that you said about nearly dying. So I need to understand what has happened to my wife, please.
Yeah. So, Mr. Miller, so your wife was operated for the removal of the innocent growth. That the procedure was myomectomy. So the procedure was went well. However, the complications happen, which like there was a retention of a small swab inside your wife's tummy. So that was she was having these symptoms, pain and high grade fever.
Oh my
So
God. And what swab? Is it something that can happen? Is it something still happening in the practice, in the
Mr.
modern
Miller,
medicine?
this is a never event. It shouldn't be happening at first place. So that's why we are looking into the matter. The team of experts are looking into the matter, like where and when, like why things went wrong. And once the report will be ready, we will be open and transparent to you and your wife. I'm really sorry you and your wife are going through this.
I don't know how this can happen. You're saying that this is should never happen to anybody.
Yes, this event is never happened. So that's why we have like our experts has made a team. We already initiate the incidents report, so to look into this matter.
So,
Is that-
so what happens next?
Yeah, so that's
To
why
my
I'm
wife?
here to
I
talk to
don't
you.
know about I don't want to know about whatever you are doing in this hospital.
Mhm.
Obviously, you will cover about what has happening, but I want to know about my wife. What happened to her next?
Mhm. So we did the operation on Mrs. Miller. So there was a collection of the pus inside her tummy. So in her care, the expert teams were involved, including my consultant. So we removed that swab and we drained that pus. And now she is in the intensive care unit. She's making good recovery. She's receiving antibiotic and fluids through her arms, and hope so. Once she will be like out of anesthesia and she will be ready to, she will be stable. So we will arrange your meeting with her as well, and my consultant will be I will arrange my meeting to your meeting with my consultant as well. So is that okay?
Okay, so is there any chance that I know if this is going to affect my wife,
um,
pregnancy plan, because we were planning to start a family, and I don't know now the
yeah,
situation.
yeah. So usually if the recovery goes well, and then most of it will not affect your wife ability to get pregnant. However, with this, there can be some scarring inside the tummy, because this was infection inside the tummy that can lead to some scarring, and like in a in a very, there are less chances that they affect your wife tubes, and so for this, don't worry. We will keep your wife under follow-up, and once she will be recovered, as you are planning pregnancy, so we will arrange a meeting with the fertility specialist as well. How this sounds to you?
No, I want to understand.
Mhm.
Please give me a clear answer. Would that affect my wife's chances for fertility in the future?
Uh, mm, Most likely not. Yeah. So
That anyway,
as
if there is any way to be sure.
what we can do that after your wife will be recovered, and then we can arrange another meeting. We can arrange another consultation to perform some tests, okay, on your wife. So we can look like how things are going. Like we will see her with her permission, her previous
What type,
record. Either
what type
she
of
was
test you do? What type of test you do?
yeah. So we can like we can check her tubes, and we can see that either she was evaluated before for releasing of eggs. So this is a blood test which we which we do usually in a couple. And may I know like either she has gone through any previous investigations, or as you're trying to conceive?
Yes, it's just a scan, and then they said there was some
Mhm.
some
Yeah.
growth in her womb, and they removed it in the first operation, and we were just delighted. Okay,
Mhm.
she will be fine, and
Okay.
after that we can start our family.
Okay, so that's good. As that fibroid has been removed, and so you can try for another 6 months. And if there will be no progress, then we will sit together and we will make further plan. We can check her tubes, like how she's doing. This is a X-ray and dye test, which is usually a daycare procedure. So we will talk about this. So don't worry, we are here to help and support you in every matter. So you are not alone in this.
It's your time. Thank you.
Do you want to know anything, any other concern?
Thank you, Dr. Fatima. Thank you. Thank you
Thank
very
you.
much. Your time is up. Okay, so Dr. Fatima, would you please tell me what do you think after the station?
Uh, Ma'am, I didn't do like good, because I should be more concise in starting. Like so she so So he should open me, and I should address all his concerns. And I should talk more about like her wife recovery, like what we will do, that we will discharge her on antibiotics, we'll keep on a follow-up and these everything. So this was really new station for me.
Yeah, but you managed, you managed to go through the station. However, there's some points, of course, that we can discuss, and it will make you even better. Okay. But
Thank you, ma'am.
thank you very much that you have this courage, to start a station like this or to present a station like this. And I would like to say something. First, I would like again to thank you. Secondly, that I know you know how to approach the station. It's apparent, but maybe the stress of the situation, okay, maybe this is what make you hesitant at the start. Okay, so let's go together to a stepwise approach on how would you best approach this station. Okay. So first of all, I would like to say that when you approach, okay, the station, you should know that you are approaching a worrying husband, okay, waiting in the recovery room. That means you are coming out from the theater, okay, and somebody is waiting, a relative is waiting, okay? So first, approach by the name. The name is clearly written there, right? So you can just confirm, okay, that this is Mr. Robin Miller, okay, husband of Mrs. Miller, okay? I am Dr. Fatima, one of the doctors who have helped or assisted in your wife operation today. I would just came out to inform you that your wife is doing well and she is making a good recovery. Just 1 second for the adhan. Okay, 1 minute, please. Hello again, and Dr. Fatima.
Yes, ma'am.
If we follow the approach, okay, of dealing with a difficult patient, and we speak about the technique, so you need to start with, as we said, greet your patient, use their name. It's given there and it's easy name, so please use it. And introduce yourself and role, okay? So who you are, I am Dr. Fatima, okay? You just say your name, okay? One of the doctor who helped in your wife operation today, okay? And I'm here to update you regarding the situation, okay? So you have now done the second step, right? Then what you need to do, okay? You tell about what is the situation, honestly, as it's, at is now, the patient have a good recovery, right? So she is currently stable with a good health, okay? And we expect that she will make a good recovery, right? So by doing this, you have at least relieved the stress, okay? Somebody is waiting, his wife went into an operation, she was very unwell, right? So now I don't want to waste the time. I need to go to the point that I'm here just to update you and reassure you about the situation. Right? Then he will start immediately to calm down, since he knows now that the wife is in a good condition and she's in the recovery. Right? This is one point. Okay? Another point, okay? Invite the role player or the patient to say their story, right? Okay, so he will start to be angry and he will say about what has happened or something like that. Okay, just seek more information about what has happened exactly before coming to the hospital today. He will tell you a brief, listen, okay, and then explain, okay? Explain that the wife came today, okay, in which condition she came with very high temperature and it was a serious infection, right? So you will need to say that there was a serious infection, okay? And this is one that we go immediately to the laparotomy, okay, to open up the tummy and find out what is wrong, okay? And what we have found that there was a collection, okay, of pus inside the tummy, okay? And this is must be because of the severe infection, okay? Here, you need to be honest about what has happened, okay? What is the cause of the infection? What is the cause of the infection?
Retain swabs.
Okay, so you need to be honest and say, okay, that this has happened because of that, okay, of the left swab. Okay, so now you understand the situation. Okay, sorry, you understand the situation, what has happened, and you need to explain what you have done today in the operation, okay, that it was cleaned and everything is fine, and she is now in the intensive care unit receiving a one-to-one care, okay, under observation following surgery. Everything seems to be okay, and her signs are reassuring, so we expect that she will continue on antibiotic till she make a good recovery. Okay, so this is the situation at the moment. This is a recent event, right? Okay, so
Yes.
Regarding his anger from the discharge yesterday from the A&E and somebody gave them antibiotics, okay, then you apologized, okay? So I'm so sorry that, don't say anything about the care, just say, okay, yeah, I can understand, okay, that you are frustrated, okay, and we will look into the matter, okay? That's it, okay? Because you don't know what was the signs and symptoms of yesterday. We don't know, right? We are not in attending the situation. Don't incriminate the colleague. And you didn't mention anything and you didn't point a finger to the SHO, so it was okay. Okay? Let the patient say whatever they want. It's fine. Let them vent. Then, again, okay, you want to establish more of the partner concern, okay? So the partner should be quiet after he is reassured about the wife's situation, and after you promise that you will do something, right? You will take an action, right? Regarding what has happened from the complaint, okay? And then you are there to listen to the concern. So the husband, okay, will say something about worrying about his, the wife health. So again, you reassure that she's on an antibiotic and she is expected to be fine, okay, and discharged from the intensive care unit, okay, within 1 or 2 days, right? If everything is okay. Then, how about the effect on fertility? There was a tiny bit that I want to speak here about it, or a comment on your answer. When I asked you directly whether this happened, what has happened, will affect the fertility in the future, you said no. Right? So you explained first about the scar, which is so much, of medical point of view, so the husband maybe does not understand. Okay, but when the role player asked you a question, direct question about the fertility, the effect on fertility, your answer should be, it's uncertain. Okay. It's too early, okay, to judge. It could affect and could not, right? Why? So, why I'm saying that? Because you don't know. You don't know if she will end up with fibrosis, as you said, the scar tissue formation, and she will have a tubal maybe blockage. We don't know, right? You don't know whether this will not affect, okay, the tubes or not. So most likely, we know that a previous infection and repeated surgery is going to affect. This is what we know as doctors, right? But what is a diplomatic answer in the exam? okay, that it's uncertainty, okay? So leave this afterwards, okay? Leave this point now. So just to explain that it could affect and it may not, okay? So how it could affect, as you explained nicely. This is about the presence of infection and the fact that she had a previous operation and the second operation, okay? That this is will increase the fibrosis or the scar tissue, okay, which can be tough or can affect the tube or can block partially or completely the tubes, or maybe it will not have any effect at all. So it's too early to say. What we will do is after your wife had a good recovery, okay, you will be invited to an appointment with a fertility specialist, and we will check, okay, if everything is okay or not, or otherwise she might undergo another keyhole, okay, surgery to look into the tubes where we insert the dye and see if the tubes are patent or not. Okay. So this is what you are going to do for the fertility question. Don't say good promises based because he is so angry or he is frustrated or something that this is not going to affect the fertility. No, it will affect, and you know it, right? But maybe partially, completely, maybe she will be lucky and she will not have an effect. So you just explain the facts, okay? Regarding the further management plan, it will be very important. 2 points here regarding management plan for this patient, that she will be observed one-to-one in the intensive unit and she will receive antibiotic, okay, until we are sure that she is improved. Then afterwards, she will be discharged to the ward until we ensure that everything is going fine, and she will be going home in few days. Or we expect that she will go home in few days. Then after that, she will have a follow-up appointment, okay? And regarding the situation will be looked into the matter. You didn't mention your consultant, so please mention, okay, about the serious event, okay? That this is going to be taken seriously, and we are going to investigate what has happened to see, okay, if everything could be done differently, okay? And regarding the event of the retained swab, of course, okay, this investigation will include all the team were involved in her care in the first operation and in the second encounter when she came to the A&E. The result of this investigation or this will be discussed with you and with Ms. Miller in an appointment with the presence of the consultant and the doctors who take care, who did the operation in the first place. Okay, so if there is anything else that I can help you with, he will say yes or no. If he's calming down, most likely he will say thank you and it's okay. If he's not calmed down, he will ask you about the pulse or about the complaint. Then in this case, you facilitate the patient to the pulse office. That's it. Okay. So thank you very much, Dr. Fatima. You were good. Okay. And
thank you.
Next time you will be even perfect. Thank you.
Inshallah. Thank you.
You're welcome, dear. So my friends, any comments from your side? Dr. Amira, you are saying about that, can we say that the symptoms she came with was similar to UTI? Actually, try to avoid any comment regarding an event where you were not attending, right? Were you there? No, I was not there, right? So just try to explain something that you didn't see, okay? So just be safe, okay? The investigation of that serious event, it will take place and they will find out if there is any suboptimal care or if there is anything that could have been done differently. That's it. Okay, dear? You are welcome. Okay, so the next, okay, is how to approach negotiation station. Negotiation station in the exam now, it's like one of the most important stations comes to you. The negotiation station is simply a patient come and request something against the guideline, okay? and you will be feeling, oh my God, what this patient wants now, okay? She wants something against the guideline, but the guideline says this and that. So I'm going to follow the guideline, okay? And I'm not going to agree her request. Do you think this is a good idea?
No, ma'am.
No,
We
it's
should
not.
we
Yes.
should take patient circumstances, her condition, everything in consideration.
Yes, good. Well done. Okay, so it's very important that you understand that the aim of the consultation is to address this patient concern in particular, okay? So it's not just to apply the guideline as it is, as a theoretical knowledge, but it's that you understand the situation, right? Inform the patient about her choice, okay? Pros and cons, that's very important. And then alternative, and let the patient choose at the end. So you are following now the principle, okay, of the medical ethics, okay? And you are respecting the patient autonomy, right? And when the patient take a decision, even if this decision is against medical advice, it will be at least an informed decision. And by informed decision, I mean, or the informed consent, I mean that the patient is aware of pros and cons together, right? So in the negotiation station, like, for example, a patient wants a home delivery after a previous cesarean section. This is a very common station. Or a patient who wants, for example, okay, to deliver by normal vaginal delivery after fourth degree tear, previous fourth degree tear, and she is currently symptomatic with incontinence, fecal incontinence. So the guidelines say that we will consider cesarean section if the patient is symptomatic, right? And the risk of the vaginal delivery that she can have another tear and she might have this incontinence getting worse, right? But the patient wants this. So what we will need to do is first of all, don't, get into a conflict with the patient. Just listen, again, active listening, okay, to the patient without interruption. Respect her wishes. Let the patient feel that she is in control in this station, okay? She is controlling her decision completely. This is autonomy, right? And emphasize and acknowledge, okay? So you show empathy and acknowledge the patient request and the reason for making it, okay? So if the patient comes to me and she wants a home delivery after a previous cesarean section, right? Or a previous tear, I need to understand why the patient wanted this request, right? So having a home delivery, right, in your comfort zone with your partners and with your partner and family surrounding, okay, can help you with the stress of labor, right? Yes, it's a nice thing, but why the patient wants this now, okay? So the patient must have an agenda. The patient must have something, okay, for this request, okay? So you need to understand what is this, what is the reason behind their request. That's very important, okay? So when the patient open up to you and tell you about why she wants this, okay, then you can manage. Sometimes patient had a previous bad experience in the hospital and she doesn't want to have this again. Maybe the patient have another reason, like for example, the patient in the strategy circuit, if you remember this circuit, that requested the vaginal birth after the fecal incontinence and the previous tear. Have you seen this patient, guys?
Yes, ma'am.
So I'll tell you, my friends, this video is very important video from the strategy circuit, okay? This video was about the situation when the patient is requesting the vaginal delivery, right, after she had a symptomatic tear, okay? And the patient doesn't want the cesarean section. there is two ways of this consultation which came in that strategy circuit, okay? The two ways were, one, okay, that you agree to the patient request. I mean that you listen and understand why the patient wants this, okay? And after the patient explain her wishes and she stick to these wishes, okay? And she explained her situation. Your role here is just to tell her, yes, agree that this can benefit her from, for example, she said that she wants a speed recovery and so on, okay, and she wants to take care of the children, nobody else will take care of them, okay, she is living also in a far area, her husband is working outside, so she had the right to think like this, that vaginal delivery will be better for her than cesarean section, because cesarean section will require, bed rest and some, longer recovery. So the patient requested that, but she need to understand what are the consequences of it. And it's up to her if she agree for the consequences or not, right? So your role is just to inform her about what are the pros and cons, what are the consequences of her decision, okay, or her choice. Alternatives, I can discuss. Yes, I can, after saying what are the pros and cons of the thing that she choose, okay, I'll tell her what are the alternatives. Please don't stick to what the guidelines say and be firm about it, okay? Because it's not black or white in the real practice. You always give the patient options, right? So if the patient, for example, she had a cancer, right? And she refused treatment, it's up to her, but she need to understand, right, what are the consequences. If she agree for these consequences, then we need to respect her wishes, whatever the wishes, right? But first, listen, emphasize, acknowledge why the patient is requesting this, okay? Show understanding of their feeling, show empathy, okay? And be a human being when you discuss with them. When you explain the guideline, don't be so firm about this, just to say that the evidence just suggested that, and this is for your safety, okay? Discuss the available options and start with the one that the patient requested. So if it was home delivery, explain what it is. If it was, for example, early induction, okay? For example, a patient who is 39 weeks and she is young, she had no other reason, and the patient wants early induction, okay? Just to start with the early induction, okay? She doesn't want to continue till the 40 weeks. She is feeling that she's now so heavy and she cannot move freely and take care of the house or anything, okay? Just to start with this point, okay? Start with her choice. Induction of labor, okay, yes, it will fulfill your need at the moment, but it will also have consequences. Like what? Like, for example, the chances of prolonged labor, right? The chances of interventions during labor, okay? And the need for continuous monitoring, the need for cesarean section in some cases because of the risk of failure, right? So you are saying those consequences, right, to the patient, so the patient will understand that this choice, okay, is not 100% correct. Maybe she will rethink about it, okay, when you are clear. But if you are defensive and you confront her and you don't agree for her choice from the beginning, okay, the patient will turn against you, and you don't want to do that, right? The shared decision-making, this is very important. You need to engage the patient in a shared decision-making process. So you agree together for a solution, okay? Okay, respecting the autonomy and preferences, very important key point here. Okay, the informed consent, remember, okay, if the patient agreed to follow the guideline recommended approach, obtain their informed consent. If not, document their refusal while ensuring their ongoing safety and care, right? So my friends, if the patient, for example, agree for what you said, okay, avoid, please, mentioning the good point only about it, or otherwise you are not honest. Right, my friends? For example, if the patient says that she agreed for a cesarean section as you told her, right? If you said about the benefit of the cesarean section without the complication of the cesarean section, are you honest now? Do you think that is that correct in the management? Is that correct in the principle? What do you think? No, it's not wise. Okay, so my friends, what you need to say is the pros and cons of everything, not only the pros of the opinion. So for example, a patient had 2 cesarean section, 2 previous cesarean section, okay? And she now want normal vaginal delivery. What will be your action? Would you please suggest? Anybody would like to counsel a patient for that?
Yes, ma'am. So first of all, ma'am, we will.
Fatima, I hate to interrupt you. I'm so sorry, but just we will let anybody of your friends.
Yes, ma'am. Yes, yes. If anybody is interested, yeah.
If they don't, I'm sorry. If nobody is interested, then you, of course, you will be my guest.
Okay.
Dr. Abu, what's the question? Sorry.
Yes, dear. If I am a patient with 2 previous cesarean section and now I want a vaginal delivery, how are you going to counsel me?
Yes. So first of all, I will appreciate her that the vaginal delivery is a very good option where the shorter hospitals take quicker recovery if the successful, and also you can have the successful vaginal delivery later on with any less breathing problems with the baby. But also I have some concerns to discuss with you. May I carry on?
Yes, sure. I like your approach.
So anybody discuss with you the what are the risks associated with the vaginal delivery after cesarean sections?
No, I just have seen my friend who had the same situation and she had a beautiful baby.
Usually we suggest the women who are having the previous 2 cesarean sections to have the delivery in the hospital setting with the team of the specialist, including the consultant and also the anesthetics will be there, pediatricians and the specialist nurse to take care of you throughout the labor. So because whenever the woman who is having the scar on the womb, they go into the labor, with the labor pains, there's a chance that the scar may get open up, and in that situation there is the risk of the bleeding, and that we can monitor by the continuous CTG. That is the strap around the tummy will be there, and we will monitor the baby's heart rate. Am I clear till that point?
Yes, doctor. So if I agree for that, I need to do this in the hospital, right?
Yes, because what happened, there is a chance of the small chance of the emergency cesarean section. We will make sure that the backup operation theater is available in case any complication arises, there is low progress or any concerns about the baby's heartbeat. So we can take the immediate action to save you and your baby.
Okay. Okay. So what if I didn't go to the labor pain, because in my first time and second time there was I passed my due date and they give me some some gel from down below, start on the labor pain, but it didn't work. So how about this time?
Yes, I acknowledge your concerns. If you don't go into the labor before the at the due date, so we have the detailed discussion at that time. The consultant will be there. We'll discuss with you either you can wait or either you can plan the elective cesarean section, or because starting the with the medications with the labor starting the if we started off the labor with the medications, there is a chance of the scar may go away, and there will be the more chances of the complication at that time. So your decision will be respected at that time. Each option will be discussed in detail, so that whatever you will choose, we will respect at that time.
Okay, okay. So, doctor, if I went to another cesarean section, as you said, a planned one, so would that be safe? Because I've heard that cesarean section, when it is repeated, it carry more risk to the woman.
Yes, you are right in saying that of course each options carry some risk and the benefit. If we go ahead with the planned cesarean section, then we can reduce the complications associated with the vaginal delivery. And but it can, as you rightly mentioned, that with the more cesarean section, as because of the previous scar, the surgery will be prolonged and the anesthesia risk. Usually it is safe procedure, but it carries the risk of the infection, bleeding, and damage to the nearby structures. But your procedure will be done by the experts. And in the long term, as you mentioned, that there can be the complications with the more cesarean section after birth problems. Sometimes the after birth get stuck to the scar, and we try our best to reduce the bleeding. And sometimes rare complication can happen in the removal of the womb also. I'm sorry to inform you about all that.
Oh, yeah. No worries, doctor. I think this is now a big decision to take.
Yes, because whatever you will choose, but we have to be open, honest with you, so that you can make the informed decision for yourself.
Yes, doctor, I'll think about it. Okay. So, if there is any way to get more information about this.
Yes, I will give you the written information. You can go through that, and I will also write back to your midwife about our plan, and arrange the next appointment with my consultant, so that you can have the detailed discussion about that. But if in case at any time you have any pain, bleeding, and reduced fetal movement, you need to come to the US clinic immediately. I will give the 24-hour contact number also. Thank you.
Yeah, thank you very much, doctor. Yeah. Beautiful, smooth counseling from your side. And thank you, because you have informed me about the pros and cons of each choice. This station will never be complete without mentioning about the pros and cons of the planned cesarean section. Right?
Yes, ma'am. Yes, ma'am. Because she was concerned at
Yes,
that time. Yes, sir.
Yes, of course, if she come and request something, okay, then again, we will discuss this, the safety around it, pros and cons, right? And then after that, we'll come to the point of the alternative. It's a safe alternative, okay? Of course, this is what the guideline and this is what the evidence advise. This is the planned cesarean section. So I must mention the planned cesarean section, and I must mention that this is recommended by the evidence, right? To reduce the risk of the, the scar went off, okay, or what we call the scar rupture. So this is very important, okay? And when you discuss for the cesarean section, you'll be again open and honest regarding pros and cons, right? So now you give the patient choice, right? And this is what all needed in that station. So you did very well, my dear.
Thank you, ma'am.
Thank you. Thank you very much. Okay, so guys, I will post for you in the group to complete the station, the session today, and to make sure that you have benefit from the lesson. I'll post to your group 2 tasks, okay? And please read the task carefully, okay? And send your records, okay?
Okay, ma'am. Thank you.
The best record, okay, will have a prize. But we make it surprise for you guys. Okay, thank you very much for attending today. And thank you, Dr. Fatima, Dr. Reka, and Dr. who presented today, and everybody who joined. Thank you. Bye-bye.